You woke up 3 weeks ago feeling off. Not sick exactly, just tired in a way that felt heavier than usual. Your legs ached, the deep, wide ache you used to associate with a hard day in the garden, except you had not done any gardening. A low fever came and went one afternoon, low enough that you did not take it seriously. You lost your appetite for a few days, and then, over the following week, a dry cough started. Not dramatic, just there. You mentioned it at your next appointment. Your doctor listened, nodded, pressed the stethoscope to your back, and said what he almost always says when a patient over 65 walks in with that particular constellation of complaints. Could be a viral thing that's resolving. Drink plenty of fluids. Get some rest. Call us if it gets worse. You went home because that made sense. Because you are 67 or 72 or 76, and things do feel heavier than they used to, and you have learned to trust the process. But 2 weeks before that appointment, you had spent a Saturday afternoon cleaning out your garage. It needed it. Winter had left it dusty and cluttered. You swept the whole floor, moved the boxes along the back wall, opened things up. You noticed some small, dark droppings near the shelving unit in the corner. You made a mental note to set a trap later. You finished the job and went inside to wash your hands. That detail, that one afternoon in your garage, never came up in the appointment. Your doctor did not ask. Why would he? And you did not think of it as medical information. It was just cleaning the garage. My name is Dr. Elizabeth Monroe. I grew up in Asheville, North Carolina, the daughter of a community hospital nurse who spent her career watching what happened to patients in the gap between what medicine knew and what medicine had time to explain. I trained in internal medicine at Massachusetts General Hospital in Boston and then completed a fellowship in geriatric medicine at Johns Hopkins. I have spent more than 20 years in clinical practice, and I want to be honest with you today about something I have seen happen more times than I can count. A piece of information that would have changed everything never made it from the patient to the physician, because no one in a 15-minute appointment thought to ask for it. That is what this video is about. Not panic, not an exotic illness from a distant continent, a single missing question, and what you can do to make sure it gets asked. Before we go any further, drop your city and state in the comments below. I read every one of them, and it genuinely shapes what I cover in the videos I make next. Now here is the central thing I want you to understand today, and I am going to say it plainly so it can stay with you after this video ends. It is not your age. It is a question nobody thought to ask. When an older adult comes in with unexplained fatigue, deep muscle aching, a low fever, and a dry cough that starts days later, the medical system has a well-worn set of explanations ready. Post-viral fatigue, deconditioning, normal aging, seasonal illness. These explanations are often correct, but there is one scenario where they are not only incorrect but dangerous. And it is triggered by a specific environmental exposure that fits the life of a retired adult in rural or suburban America almost perfectly. That scenario is Hantavirus pulmonary syndrome, and the reason it slips through is structural, not personal. There is no billing code for ask the patient what they were doing in the 4 weeks before they felt sick. It does not fit in a standard intake form. So the question is not asked, the dots are not connected, and the window for intervention closes quietly while the patient goes home to rest. Before I go any further, I need to stop and be direct with you about something. If you are watching this video right now and you are experiencing worsening shortness of breath, the sensation that your lungs are filling with fluid, a heart that is beating rapidly alongside a fever, or any sudden deterioration in your breathing, do not finish this video. Call emergency services or have someone drive you to urgent care immediately. Tell them you may have been in a space with rodent activity in the past several weeks. Those specific words will change what test gets ordered and how fast your care team moves. If you are watching because you are curious, because you want to protect yourself going forward, or because you know someone who has been dealing with fatigue that nobody can explain, stay right here. What follows may be the most practically useful 20 minutes of health information you have come across in a long time. Stay with me through all 5 pieces of this. The third one is the one that genuinely changes the picture for people over 60, and the 5th one costs you nothing and can be done before you go to bed tonight. Let me tell you about Dorothy. Dorothy was 68 years old, a retired school teacher from a small town in rural Tennessee when she first came into my office. She'd already been to her primary care physician twice in the 6 weeks before that visit. Both times she had described the same symptoms: persistent fatigue that felt different from ordinary tiredness, deep muscle soreness in her thighs and lower back, a temperature that hovered around 99 degrees in the evenings, and nausea that made dinner unappealing most nights. In the 2 weeks before her second appointment, a dry cough had joined the picture. Her doctor ran a standard workup. Thyroid was normal, complete blood count was unremarkable. Chest x-ray showed mild haziness that he attributed to an early atypical pneumonia and treated with a course of antibiotics. He told Dorothy she had likely had a viral illness that was clearing slowly, and that her fatigue and breathlessness on the stairs were, in his words, things that tend to accumulate with age. What no one had thought to ask Dorothy was what she had been doing in the weeks before her symptoms began. 6 weeks earlier, she and her husband had driven up to the family's hunting cabin for the first time since the previous autumn. It had been closed up all winter. Dorothy spent most of a day inside cleaning, sweeping floors, pulling things off shelves, clearing out a back storage room that had clearly had heavy rodent activity throughout the colder months. She used a standard broom on the floors. She did not wear a mask. She did not think she needed one. Dorothy had Hantavirus pulmonary syndrome. A clinical review published through the National Center for Biotechnology Information describes the prodromal phase of hantavirus cardiopulmonary syndrome as nearly impossible to distinguish from any other nonspecific viral syndrome during its initial stage. Think about what that means. Every symptom Dorothy described, the bone-deep muscle fatigue, the low fever, the nausea, the dry cough appearing days later, is on a list that could apply to a dozen conditions in a 68-year-old woman. Without the history of that cabin, the differential diagnosis simply does not include hantavirus. And without the diagnosis, the test is never ordered. This is the heart of what I mean by medical autopilot. It is not incompetence. It is a system that processes the information it receives, and in a 15-minute appointment, the information about a dusty cabin 2 months ago does not usually make it into the room. Think of the body right now, like a pipe in your walls. Most of the time the water flows, everything works, you have no idea what is happening inside. Hantavirus is a slow crack in that pipe. For weeks, nothing looks wrong. The crack is there, the damage has begun, but the ceiling is still dry, the walls are fine, nothing in the house tells you there is a problem. And then, faster than you expect, the ceiling caves. Now, here is where it gets important. Let me tell you where this exposure actually happens, because for most of my patients, the answer is not where they expect it to be. The highest risk scenarios for adults over 60 are not wilderness camping trips or hiking trails. They are not even farms, though farms do carry elevated risk. The highest risk spaces for the senior demographic are ones you have owned for years. A garage that gets opened properly for the first time in late spring after a hard winter. An attic you access twice a year for holiday storage. A garden shed that stays closed from November to April. A vacation property, a hunting cabin, a family camp, a storage unit in an older building, a basement that flooded last fall and had to be cleared out. These are precisely the tasks that retired adults tend to manage themselves, at a time in life when they have more time to maintain their property, more energy to invest in the kind of housekeeping they never got to during working years, and, unfortunately, less awareness of what a poorly ventilated, rodent-frequented enclosed space can contain. Let me tell you about Walter. Walter was 74 years old, a retired farmer from outside Des Moines, Iowa, and he had been maintaining his property for 4 decades. He was not careless. He was experienced. But in his late 60s, a deteriorating knee had made his annual barn cleaning more difficult to do the traditional way. So he had started using a shop vacuum to clean the storage areas faster. He did not know that vacuuming dried rodent droppings is exactly the wrong approach. A shop vacuum does not contain those particles. It pressurizes the air and releases them in a concentrated cloud directly into the space where you are standing and breathing. Walter was told at 2 consecutive appointments that he had bronchitis. He did not have bronchitis. The deer mouse is the primary carrier of sin nombre virus, the Hantavirus strain responsible for most North American cases. The mouse does not get sick. It carries and sheds the virus in its urine, droppings, and saliva continuously and silently. When those materials dry out in a closed space over weeks or months, the viral particles become airborne. You do not need to see a mouse. You do not need to touch one. You simply need to breathe the wrong air in the wrong room at the wrong moment. The CDC's Health Alert Network advisory issued in May of 2026 in response to the international cluster of hantavirus cases linked to the cruise ship that made international news, confirmed again what clinicians have known for decades. Early symptoms of the illness, including fever, headache, muscle aches, nausea, and fatigue, are easily confused with influenza or other viral illnesses, and healthcare providers almost universally require an explicit exposure history before hantavirus enters the differential at all. That history lives with you, not your doctor, you. Type the number 2 in the comments right now if you have ever cleaned out a garage, shed, cabin, or attic without wearing any kind of mask. Just the number 2. I want to see it. Here's the third piece of this puzzle, and this is where the biology changes for people our age. In a young, healthy immune system, the response to hantavirus is fast and coordinated. The body floods the infected tissue with immune cells almost immediately after the virus reaches the lungs. That rapid response is uncomfortable, but it often contains the damage long enough for supportive care to work. In an older immune system, the dynamics shift in a specific and dangerous way. The science of immunosenescence, which is the gradual change in immune function that occurs with aging, tells us that the older immune system tends to mount a slower and less organized initial response to novel pathogens, followed by a more exaggerated and prolonged inflammatory reaction once the infection has already progressed. The result is a clinical picture that looks deceptively mild for longer and then deteriorates more suddenly once the second stage arrives. A paper published in Frontiers in Immunology examining acute lung injury in older versus younger subjects found that pulmonary inflammation was measurably more severe in older subjects across every marker tested. Worse tissue damage, higher cytokine activity, significantly slower resolution. What that means clinically is that an older adult with hantavirus infection may have less obvious fever, less dramatic early symptoms, more vague fatigue, and a longer window in which the disease looks like ordinary illness before the lungs begin to fill. Think of the capillaries in your lungs as a rubber garden hose running along a wall. Normally, water flows through cleanly. Hantavirus targets those capillaries directly. It punches thousands of microscopic holes in the wall of that hose simultaneously. Fluid pours out into the surrounding lung tissue. Your lungs, designed to hold air, begin filling with liquid instead. This process, called pulmonary edema, can move from a persistent dry cough to critical respiratory failure in less than 48 hours once it begins in earnest. The mortality data are not reassuring. A clinical overview published in the NCBI StatPearls database places the case fatality rate for hantavirus pulmonary syndrome at up to 38 to 40% among patients who develop full respiratory symptoms. 4 in 10 people who reach the critical stage of this illness do not survive it. Among older adults with pre-existing cardiopulmonary conditions, and that includes most people over 70, the risk climbs further. A dry cough that begins 4 to 10 days after the first symptoms is the alarm bell. Not a wet cough, not a dramatic wheeze. A quiet, persistent dry cough is the sound of your lungs entering the second phase. When that cough begins, the window for intervention is narrow and closing fast. If you have been dismissed before, told that your shortness of breath is just getting older, that your fatigue is just your age, that what you are feeling is probably nothing, I want to say this directly. You are not wrong to be concerned. You were just given an incomplete picture. That is what this video is here to change. This brings me to the piece that most viewers carry out of here into their next medical appointment. The problem is not your doctor as a person. Let me be clear about that. I have tremendous respect for the colleagues I trained alongside at Mass General and at Hopkins, and I can tell you from inside the system that no physician seeing an older adult with fatigue, muscle aches, and a low-grade fever is automatically thinking Hantavirus. It is statistically rare. It presents identically to a dozen more common illnesses. And the single piece of information that would change the entire diagnostic process, what were you doing in the 4 to 8 weeks before you got sick, simply does not appear on a standard intake form. There is no billing code for environmental exposure history. There is no checkbox for closed building with rodent activity, so the question is not asked. The pieces do not connect, and the test that would confirm or rule out the diagnosis is never ordered, because according to both the CDC's clinical guidance and the criteria used in standard practice, hantavirus testing is not typically initiated without a reported history of potential rodent exposure. The CDC's most recent guidance for clinicians states explicitly that healthcare providers should consider testing a patient for hantavirus if they have compatible symptoms and have had contact with rodents. The key phrase is contact with rodents, which, in clinical practice, often means the patient has to be the one to surface that information. The physician cannot know what was not reported. You have the ability to change this outcome entirely with one sentence. Before you describe your symptoms at your next visit, before you list what hurts and for how long, say this: before I get into my symptoms, I want to mention that I may have been in a space with rodent activity in the past several weeks. That sentence is free. It takes 8 seconds, and it changes the entire conversation that follows. How old are you right now? Write your age in the comments. It genuinely shapes which topics I come back to week after week. Let me tell you about Margaret. Margaret was 66 years old, a retired librarian who had lived her whole adult life outside Asheville, not far from where I grew up. A water pipe had burst in her basement the previous winter, and after the professional remediation team finished their work, Margaret spent a weekend sorting through the boxes and storage areas herself to see what could be saved. She wore thick work gloves. She did not wear a mask. She did not know that the storage corner nearest the burst pipe had been showing signs of rodent activity for months before the flooding. 3 weeks later, she came to see me managing what she had been calling a stubborn cold. I asked her the question. She told me about the basement. We ordered the test the same day. Margaret's illness was caught early enough that she received intensive supportive care before her lungs crossed into the critical threshold. She recovered. She was home within 2 weeks. What saved her was not a medication. There is no specific antiviral treatment for hantavirus pulmonary syndrome. What saved her was a question, and the test it unlocked, and the speed with which her care team was able to prepare for what her lungs were about to do. Prevention and early recognition are not secondary tools in this illness. They are the only tools we have. Here is what you do starting tonight. Step 1. Walk through every enclosed space on your property that you have not opened recently. Your garage, your shed, your basement, your attic, any outbuilding or storage unit. You are looking for signs of rodent activity, small dark droppings about the size of a grain of rice, gnaw marks on wood or soft materials, shredded paper or fabric that looks like nesting material, grease trails along the base of walls where rodents run. You are not looking for an actual mouse. You are looking for evidence that will mouse. You are looking for evidence that one has been living there. Step 2. If you find evidence of rodent activity, do not sweep and do not vacuum. Open the doors and windows to that space and let it ventilate for at least 30 minutes before you enter to do any cleaning. Fresh air moving through a contaminated space significantly reduces the concentration of airborne particles before you disturb anything. This costs you nothing. Step 3. For the actual cleanup, use what professionals call the wet method. Mix 1 part household bleach with 10 parts water. A bottle of bleach costs less than $2 at any grocery store. And spray the droppings and the surrounding surface thoroughly. Let it soak for 5 minutes. Then wipe with disposable paper towels and seal everything in a plastic bag before putting it in the trash. Never use a dry broom or a vacuum in a space with rodent evidence. Step 4. Wear an N95 mask and disposable gloves anytime you are cleaning a space that has shown rodent activity, even after you have done the ventilation and the wet treatment. N95 masks are available at any hardware store for less than the cost of a cup of coffee. The N95 is the specific filtration standard that stops the particles carrying Hantavirus from reaching your airways. A standard surgical mask is not enough for this exposure. Step 5. Tell your doctor. If you have been in any enclosed space with potential rodent activity in the past 8 weeks, bring that up at your next appointment before you describe any symptoms. Write it in the patient portal message ahead of time if your practice has one. That one piece of information, voluntarily offered, is worth more than any screening scan in terms of its potential to redirect your diagnosis if something has happened. I have spent 20 years watching people arrive at the right diagnosis weeks later than they needed to, not because the medicine failed them, but because a single piece of context never made it from the patient into the room. The medical system was built to process what it receives. You are the one who controls what it receives. The research on hantavirus misdiagnosis, the clinical descriptions of how perfectly its early phase mimics ordinary aging illness, the data on what happens to older immune systems when the second phase arrives, all of that lives in the peer-reviewed literature. It does not fit into a 15-minute appointment. That is what this channel exists to bridge. This is not a reason to be afraid of your garage. It is a reason to know your garage, to know what to look for, and to know the one sentence that changes your doctor's entire diagnostic process if you ever need it. If this video gave you something useful today, hit the like button right now. It is the single most effective thing you can do to help this information reach another 70-year-old who is about to open their shed this weekend and does not know what you now know. Which of the 5 steps are you going to do first? Tell me in the comments. I make videos like this every week. Evidence-based, practical, built around the gap between what the research shows and what fits into a standard appointment. Subscribe so you are there for the next one. Until then, take care of yourself and take care of someone you love.